Nancy, we can't hear you. I think you're muted.
Well, that's the way our day's been going. So good afternoon, families, community members. Thanks for returning, and thanks for new folks that are joining us today. I have on the call, if you can see, one of our internet, we had one without a computer, Mary Ellen Manning, our Director of Talent and Personnel, Mike Foran, Assistant Superintendent, Jackie Maddie, Everything COVID, our Nursing Supervisor for the district, and Mark Spalding, our Director of Pupil Services. We did say we're going to meet weekly and again next week. And so today it's a little bit different. I want to go over the updates that we received this week, yesterday morning, actually, at our state public health call. And then we'll go into just a reiteration of the slides that we have that stayed the same for those people who are new to the call. So for those of you who are returning, we are going to do the what's different, what's new this week right up front. So if you don't want to watch the rest, you can tap out. And for those who are new, you can stay on. So Matt, if we can start. Okay, so what's new? Many of you, maybe just from the governor's press conference the other day or from the media, have seen that Governor Lamont, his executive order, states that all current staff are considered covered workers, excuse me, which includes all of the new hires over the summer, must be vaccinated on or before September 27, 2021. One, they're fully vaccinated against COVID-19 by September 27th. The second one is they've already received the first dose and have a visit for the second dose already lined up by September 27th. We do have areas for exemption, and the ones we know of today are an exemption for religious or for medical. Both must be applied for. It'll come through our talent office. We have forms for our staff to fill in. We'll also be requiring our staff to upload or provide us with verification of vaccination. So that's the biggest news that we talked about on our call Tuesday morning with Commissioner of Education and the Public Health Department. Jackie, did I miss anything there right now?
Nope, that's where we stand right now.
So feel free also to use the chat, families, parents, community folks. If you have questions, put them in and we'll try to answer them in real time, but that's our biggest news for the week. Okay, and I'm going to say let's go to the second slide. And it just basically goes over what covered worker means. So a covered worker is all employees, full-time, part-time, contractors, providers, assistants, substitutes, student teachers, interns, and anyone else working in public or non-public pre-K to grade 12. So clearly we're covered. It includes individuals providing operational or custodial services who are coming in on a regular basis, not someone who's coming in only once. And again, like we did last year, anyone coming into our buildings must stop first at the front office and sign in, and we keep an electronic log of all of the people in our that are visiting our schools, and that's really for contact tracing purposes. What a covered worker does not include any outside vendors, contractors, and employees, like I just stated, that are here for a one-time or a limited duration, or a volunteer. However, if you are a parent and you work for the school system, you will be considered a covered employee. Volunteers who are in weekly, and Mary Ellen, I'm going to turn to you on this one. If they do need.
It's up to the school districts, and we are asking that they.
So a volunteer who is in on very frequently, and I would define frequent as at least once a week, once or twice a week that they're in the building and they're interacting with students, we will be requiring vaccination for those folks as well. All staff must present acceptable proof of vaccination by providing one of the following. We'll be going over this. We have a town hall for staff tomorrow that will be going over all of this for them. All of our teachers and all of our staff actually are back for the first day today. They'll be here today. They're here tomorrow, Friday off, and then they come back Monday and Tuesday for professional learning before your kiddos come back on the following Wednesday. Okay, Matt, thanks. Next slide. All right, so there's been some updates on the student travel. I'm going to turn it over to Jackie Maddie to talk about the changes.
So the changes to travel have to do with who needs to quarantine and who does not need to quarantine. So we've gotten some updates now. Students who are fully vaccinated and those students who are age 12 or older are eligible to be vaccinated. Those who are fully vaccinated do not need to quarantine. Students who have traveled and who are not fully vaccinated do need to quarantine. Students who have traveled domestically, and that includes U.S. territories such as Guam, Puerto Rico, and the American Virgin Islands, they may return to school on day 8 as long as they are COVID tested no sooner than day 3 after they return to Connecticut, and they must provide proof that that test was negative. Students who travel internationally similarly may return on day 8 as long as they get a COVID test no sooner than day 3 after they return back to Connecticut and they have proof that that COVID test was negative. Anyone who declines to be tested, whether they travel domestically, and domestically can mean going to Massachusetts or New York, it's anywhere outside of Connecticut. If they choose not to be tested, then they cannot return to school until day 11. And day 0 is the day that you return back into Connecticut. And always a reminder, if a student is experiencing COVID-like symptoms, whether or not anybody's been vaccinated, they are sick and they need to remain home until the symptoms are no longer present.
I'm just going to speak from a parent lens. It's always hard because so many days our little ones will wake up and say they have a tummy ache, they have this, they have that. And now we're encouraging you to listen and to take precaution. And if they are presenting with symptoms or they feel sick, it's best that we keep them home. Thanks, Jackie. Next slide, Matt.
Okay, so this is our student quarantine for exposure to someone who has tested positive for COVID. So students who are fully vaccinated, who have a close contact, whether it's in a school setting or a not school setting, do not need to quarantine. Students who have had a close contact to someone who has tested positive need to quarantine for 10 days, which means they cannot return to school until day 11. And day 0 is the last day that they were exposed to the person who tested positive for COVID. So if I have COVID and Superintendent Sarah is with me today, it's Wednesday, and that would be day 0. And then we would start counting. Day 1 would be Thursday all the way to day 10, and then could return to school on day 11 as long as they are well. I also defined what a close contact was as far as distance. If you are in a school setting, if students are in a school setting, everyone in the room is wearing a mask, they are sitting, there's not running around activity going on in the classroom, then a close contact is someone who is closer than 3 feet. And that's based on the Center for Disease Control studies that were done over the last months. And they found that when people were masked, students were masked, sitting and not moving around, that the respiratory droplets were only going a short distance, a little more than a foot. If students are moving around or they're in other areas in the school, for example, they're in the hallway, the cafeteria, the gymnasium, then we're measuring distance closer than 6 feet. And we're looking for contact more than 15 minutes over the course of 24 hours.
Thank you, Jackie. Next slide, Matt. Jackie, do you want to give an update, anything to update on here as far as the screening goes?
So we're working with the State Department of Public Health. They are going to be providing free COVID screening for students grades K through 12 if if the students are not vaccinated and if their parent wants them to be screened. This is something that you would sign up for. It's not something that we're doing for everyone. As soon as we receive the permission forms and the information from the laboratory, we'll be sending that out to parents, and those who wish to have their children screened their unvaccinated children screened every week can sign up for that. And we'll be screening unvaccinated staff members also.
We have
You want to stop and answer some questions?
Yeah, we have some questions about travel I think we should address if we moved on from there.
Oh, hold on 1 second. Oh, wow.
So I know
I didn't have this turned on, sorry.
All right, let me do one question because someone asked about students being mandated to vaccinate. The vaccinations that are required for school are part of the state guidelines. They're legislated. We cannot mandate vaccines unless the state orders that. So at this time, no, students are not required to get the COVID vaccine. It is available for those 12 and older, and we will be running some vaccine clinics this weekend and the beginning of the week, but it is not required.
Thanks, Jackie. And there, I see there's Ms. Flores, why we can't have online classes, and thank you to one of our parents for answering the question. The option for remote learning is not a district choice. The commissioner has made it very clear that we are to go to 100% in-person learning 100% of the time. And that was done with that balance of students and families' social, emotional health and physical health. And Jackie pointed out earlier on that throughout the course of the year, what they studied was students, and this is that one exception, who are sitting in classrooms can sit 3 feet apart while fully masked and not be considered a close contact. And that only means in the classroom. So I support the State Department of Education. I understand the fear, right? I think we all have it. But we will be as vigilant as we can. We will be doing the 24-hour cleaning at least daily. We have 24-hour wipes, and we're doing all the high-touch surfaces. We'll get to that slide later on. And it all boils down to how many mitigation strategies do you have, right? That layered mitigation strategy that's going to keep our students safe. I think we're pleased that the state has recognized that employees in our school districts should be vaccinated. I know that's going to help for continuity of instruction. If our staff is vaccinated, there won't be as many folks that are out. And so as far as children goes, again, one of the questions was, will students be forced to be vaccinated? Jackie, maybe you can answer. I mean, we don't have an answer on that, and that's not a choice that we will make, but maybe you want to talk a little bit about that.
Say again what sorry, you cut out on me.
Oh, that's okay. Sorry. It's one of the questions was, will students be forced to be vaccinated as it becomes available to the younger age groups?
No, not unless the state of Connecticut legislates that.
Thanks, Jackie. And then the next is, what happens if a child were to go on quarantine due to possible exposure? Do they get assignments from the teachers, staff for the time they are out, or will there be some kind of remote learning? So I'm going to be covering that in a slide, Ms. Makarski. So when we get to that, we do not have remote learning options this year. That was, again, from the commissioner's office. The only time we would do remote is if we have to go into a full remote setting because the infection rates are too high in the state of Connecticut. We would be taking counsel from our local and our State Department of Public Health. Those aren't decisions that I make. They are, we do it in concert with people in the medical field to make sure we're making the best choice. Jackie, you might have answered this. This is from Mrs. Janchek. When you say domestic travel, it is by public transport, or do you mean they need to quarantine if they go to Rhode Island or the Cape by a family car?
If you leave the state for more than 24 hours, no matter how you get there, you are considered to have been domestically traveling, and then you would need to quarantine.
Is that per the executive order, Jackie?
That's guidance from the CDC defining travel. So me going to Massachusetts to visit someone and then returning within 24 hours does not meet the guidelines. Less than 24 hours. It needs to be more than 24 hours.
All right. So one of the it's a comment, just wondering about what sense does this make? If you're vaccinated, you can still get COVID and transmit the virus to others. Can you speak to that, Jackie?
The transmission between or people who are fully vaccinated getting COVID is a very, very small percentage of the people who are positive for COVID. The great majority of people who do get infected with the COVID virus are unvaccinated. They also are more likely to spread that virus. So we are working very hard to get people vaccinated to help reduce that viral load and make it safer for everyone in our community.
And the teachers and the staff will be masked as well. What happened with kids that had to be in small groups in the classroom? Are they still going to be like that this year? It's 100% return of all students. Just prior to this call, I did meet with our IT department to look at our current class sizes. Our class sizes are at this point pretty small. We're talking about kindergarten and first grade, all under 20, all under 20. So again, and we have the 3-foot distance now instead of the 6 because of the research that was done on exposure with students who are 3 feet apart and lack of the airborne particles did not go that far. Did I say that correctly, Jackie? Okay. Could it change if the numbers increase again? Yes. So Marlena, yes. And that's what's probably the most frustrating with this, right? I love to come out and have answers that are concrete and will stay the same. But I can't promise that. It's very similar to last year when we had to, or the year prior, when we had to go on March 13th and just completely lock down. And it's so hard to be flexible. I understand the hardship, you know, as a parent raising children. Our goal is to stay open for the entire year at 100%. That is our goal. And I know that's the State Department of Education and Public Health's goal as well. But we have to wait and see what the numbers are and if the virus increases. Okay, thanks for being flexible. I keep trying, but it's hard. It's just really hard. It's a moving target. So I appreciate that. Could we go to the next slide? Right, and I stated this comes from the State Department of Education statement that there will be no universal remote learning for the 21-22 school year until further notice. I added that in because of that flexibility piece, because we just, right now, that's not our intention. So, and I do want you to know this is recorded and all these slides will be available. What I don't want to do is read slides to you, but basically, for this year, there's a shared commitment in Connecticut to provide equitable resources and schooling, refocusing on in-person learning opportunities for the school year. It's better for our students to be in the classroom. It's better for our students to see their peers and their adult supports, to have access to nutrition and health resources, not saying that we don't have it at home, but we know not everyone does have it at home. And the opportunity for social emotional interactions. That's really important. I'm going to speak just as a grandparent watching my youngest grandchildren struggling with, developing in a way where I'm hearing them try to say words or those kinds of things. And we know that we're social people. People are social. And being together and learning together is what's best for our kids. And so it's that, right, it's that weighing of the physical, fear of the virus versus fear of our students not excelling. And I don't mean just academically, I mean the whole child. Next slide, Matt. So Veronica, you asked about carrying a Chromebook, backpack, and school supplies. The Chromebook is a tool that they will be using every day still. It's not heavy. They can put it in their backpack. You'll notice, similar to last year, there's not books really that are coming home very much. Most of the materials can be accessed online, other than maybe a packet of papers or something like that for our youngest learners who are practicing how to write. But yes, that is. And so again, the student's responsibility to make sure that the Chromebook is charged and ready for the next day, which sometimes for our youngest learners means that the parents have to remind them to do that. And even for our older learners too. Again, sometimes our teenagers forget a lot. So anyway, that is one of their kind of homework every night, is to make sure their device is charging for the night and ready for the next day. So what social emotional supports programs will be offered in school? Sharon, I'm going to get to that in a little bit. I'll talk a little bit about our recovery. Matt, we do have our recovery plan online, correct?
That is correct, yes.
All right, so can we just put the link for our recovery plan too, so our families, and again, our recovery plan is not only during the day, but we're going to be doing before school and after school recovery, both social, emotional, and academically. We're going to have super Saturdays throughout the year and Teachers in the Park evening events. So we have a lot of things going on to help recover just some time lost with our students. And I really don't want to look at it as loss. And again, we are really about accelerating through enrichment, making sure our students have what they need, balanced with those students who maybe aren't reading at the level they should be, being invited to attend 6-week tutoring sessions in the schools that parents can sign up for multiple 6-week sessions. So more on that, and Matt will put the link right in the chat for you to take that, so you can take a look at our recovery plan. Okay, I'm going to have Mark take this over. We're going to talk a little bit about the difference between homeschooling and homebound tutoring. Go ahead, Mark.
Sure. Hi, everyone. So if you can back that up, please. Homeschooling. Okay. So I noticed someone on the chat did mention that they were going to homeschool their child, and so you do have the right to, if you feel for whatever reason that you want to homeschool your child, you have the right to do that. You have to contact the district, the superintendent's office, or designate. Contact me, for instance, and then we will acknowledge that. And when you're then essentially removing your child from the district, and when you do that, that means the district and the Department of Ed are no longer involved, and you're expected to provide the same kinds of curriculum and supports that you would receive in an educational setting. So it's almost like if you took the child and put them in a parochial school or moved to a different state, for instance. That is your right to do that. You have to understand, for students on 504 plans and IEPs, if you do that, those supports no longer exist. Now, you can re-enroll your child at any time. And I've had a couple of conversations with parents, today and this week. And I just want to let you know, if you decide you want to take your child out of the school and homeschool, and then because of COVID, let's say, the pandemic, and you're concerned, and at some point in a month or two or whenever you want to come back, even if the IEP is expired, in other words, the reevaluation date or the annual review is expired, we're going to implement that IEP immediately. We'll go to additional testing, but I want you to know that in this district, we're going to be put those supports in immediately upon your return. So I want to put everyone at ease at that. And we will help you with guiding you to the state website that shows you the curriculum and information that's out there for parents that want to do that. But I just want to let you know, when you do that, you are removing your child from all supports from the district, okay? And then Jack, if you want to talk about the medical piece on homeschooling, next slide, please, Matt.
So homebound or hospital instruction or learning are for students who cannot attend school, even if we make reasonable accommodations. And that's because they have a medical or a mental health condition. To apply for that, the treating physician, the physician who is taking care of the student and who is working on the condition that's keeping them from coming to school, provides the school with a medical statement. It has medical diagnosis and also includes the documentation, and it gives us dates that they estimate that the child will be out of school and when they believe the child will be able to return to school. So the instructional hours, as designated by the state of Connecticut, for students in grades K to 6, it's 5 hours, up to 5 hours a week. And for students in grades 7 through 12, 10 hours per week. The instruction is provided in the home, in a community setting, such as in the public library or at another agreed upon location. So this is very different than, this is not remote learning.
Correct.
Thank you, Jackie. I'm going to just stop and answer a couple of questions. Jesse, I feel your frustration. I understand, and yes, that is the way it is. And again, just wondering, can your mom travel from Massachusetts to Connecticut? I don't know if that's a possibility. And then Itzel Cologne asked what type of precautions will be this year, especially at the high school, since it's so packed. The high school is not really so packed. It used to be much more packed than it is, and not because we've over the years it's decreased. I know when my son went there, I think we had 3,500, and now we're down to about 2,300. In the classrooms, again, we looked at class sizes today. They are not packed, and we're going to do the same things that we have done at our elementary and our middle schools. We're going to make sure kids are fully masked and all adults are fully masked in the building. We know that the ventilation systems are working at 100% capacity. We will continue to do contact tracing in every building, and we will cohort, and that means just keep kids in groups. The high school clearly will be a little more difficult because they're going to classes. But in terms of sitting in the cafeteria, we've talked to principals about making sure kids are spaced out as they can be. And again, if your child's done after 10 minutes eating in the cafeteria, we're going to ask them to mask up again in the cafeteria if they're not eating. And all of the mitigation strategies. And then the other is the 24 disinfecting wipes that will be ongoing to all high touch point areas throughout the buildings. And that's an ongoing thing. Did I miss any, Jackie?
No, I think you got that done.
Question about kindergarten. Will kindergartners need Chromebooks from Anita? I believe they'll be issued within the first few days of school on new devices to kindergartners.
Yep. And there was another question about repair or making sure that they're functioning. And so your child will bring them to school, and we do have tech support in the buildings. And so they'll run through and make sure, do housekeeping on the computers to make sure that they're up and running. Anita, will this information be posted somewhere to reread? Yes, it will be. This is actually where we're recording this. And so we'll have this there. We'll have the whole recording and the handouts as well for you. Thank you, Jeff. Jeff just jumped on. He's our IT, the manager of IT, and he said Chromebooks will be distributed in the first days of school.
And Mark, it looks like Veronica has some questions individual to her student. Is there somebody she can contact regarding that?
I would invite Veronica. I can put my information in the chat somewhere. We make that available. You can reach out to me. We can have a conversation tomorrow if you'd like. Yeah.
So Matt, can you put Mark's contact information, and Veronica, Mr. Spalding will reach out to you tomorrow. All right. Next slide. And again, I think I've said this 100 times, but worth repeating. Face masks are required by all staff, students, all visitors while in the school. The face masks in concert with all of the other mitigation strategies is what keeps the virus away from our kids. And I was I don't know if pleased is the word, but I felt good after we had our Tuesday call, which was yesterday morning. And they were saying that there was such a low rate of transmission from student to student in the buildings last year. And we know that it was sometimes it's more the adults than it is the students. And so, we did notice that. We meet every single day. There's a team of us that meets every single day, and we know about every issue in every building. We have a very thorough contact tracing. And so I feel confident. I mean, we've had a year to practice how to go through the drill of these things. And we were able to be successful last year. All right. Oh, and Jeff also, who's on the Facebook, is saying there will be device insurance for purchase. Oh, thank you. Thank you, Matt. Emergency. Do school buses get cleaned, wiped down? Yes. School buses use the same 24-hour wipes as we are using in the buildings. Drivers are masked. Students are expected to be socially distanced, and we crack windows even in the cold winter. We do keep the windows open just for airflow. Marlena, as far as breaks in the outdoors, barring inclement weather, it's not bad for kids to be, as long as they're bundled up, it's not bad for kids to go outside and get fresh air. And Jackie, you can talk to that. I remember my days as a building principal. There was these ideas that they can't go out at this temperature or this temperature. And maybe you could just reiterate, being outdoors is always healthy.
Being outdoors is excellent. It helps not only reduce the virus load when we're apart and the fresh air is blowing around, but it's just good for kids to be out and to be active with one another. Generally, we are looking for temperatures to be steady. The acceptable temperature for going out depends on what part of the country that you live in. So we focus a lot on the inclement weather, whether it's raining or snowing, and of course, making sure that all of our kids are dressed appropriately for the weather.
I'd just like to address Ms. Flores. I see you're saying that we don't care about the kids, and there's nothing farther from the truth. We all take an oath, that we care for the kids very much. The wipes that we purchase are 24-hour lasting wipes. They leave a residue, a film on it. It lasts for 24 hours. If it needs to be wiped down more often, we have custodians and aides cleaning all day. Next slide, please. So transportation, regular transportation will be available for all of our kids who live outside of the walk zone, no different than usual. And again, special transportation will be provided for our kids who have special transportation identified in their IEP or 504 plans. And again, we talked about drivers and must wear a face mask while on the bus, and students should practice social distancing. What was that?
They're covered workers too.
Oh, that's right. Thank you. And they're also, the bus crew are also considered covered workers, and covered workers will need to be vaccinated. All right, next slide. Oh, thanks. So daily, Jackie, do you want to take this one?
Sure. There's actually, people have asked quite a bit about what are the signs and symptoms of COVID. If you go to the State Department of Education website, there's an addendum number 5, and that's the guidelines that the school nurses follow. There are some symptoms that are considered to be high symptoms of COVID, such as a fever, or coughing, loss of taste and smell, where one symptoms is what we deal with, and then we contact the parent. Other symptoms, we're looking for 2 or more symptoms. Symptoms for COVID are similar to symptoms for other things, and we're acting, thinking about the health and safety of everybody. So when someone has the symptoms, we do get in touch with you. And we may ask that you get your child tested or that you contact your medical provider. There is testing available in the city. Again, there is testing now at Veterans Stadium. So it is available to us. We also encourage you to speak with your medical provider. If we do have a letter from your medical provider that says the problem your son has, for example, allergies, runny nose, and itchy eyes, if we do have that on file, then we will not be thinking COVID as the very first thing.
Superintendent, there's a question about whether this information is going to be translated into Spanish.
Our interpreter is coming, our translator is coming on in about 2 minutes. I'm sorry, she had to get from one place to the other. She will be on shortly. Okay, quick question. As a senior, oh, I just missed it. Hold on. As a senior now, remote learning was way better for me and for my grades. Why can't we have and remote learning? Oh, it's not a decision that I made. This is a decision that, and again, I don't think it's a bad decision. I understand for you, you succeeded. Many students did not feel the same way. And I think the State Department of Education, in conjunction with the Public Health Department, decided that it was better for all students to be in. But I respect you stating that it was a better way for you to learn last year. I will say, I know that our teachers will still be using many of the platforms that they used last year. And if during your class, if that's something, I mean, even with headsets and you want to just tap into just your computer there, that might be an option if you talk with your teachers and at the high school. I'm sorry that you prefer that method, and I can't offer that to you. Okay, Crystal DiBattista Bassett, you stated about little ones having tummy issues. Mine's a second grader. I agree, it happens, but if he is out, does that mean he has to get tested to come back with no symptoms, Jackie?
If they have symptoms of COVID following that guidance that we're using from the state, then we will ask that they be tested, or that you provide us with a medical note that says that they do not have COVID. If the symptoms that they have don't meet those COVID symptoms, again, as the state's listed, then when they're feeling better, they come back. Many children have tummy aches. That is not a high COVID symptom. We'd be looking for more than one issue for our minds to be thinking COVID. So then we would be just waiting for that issue to resolve.
Thank you. And will there be seating arrangements in the buses, or the kids, will they all be seated together? They will need to socially distance. We don't have seating arrangements on the bus, or we don't, but students know when they come on, and they'll be reminded by the bus driver that they need to remain socially distanced. It's okay if they come on the next day and sit in a different seat. They will be disinfected. So that's that. And I'm waiting on Myra. She will be here very soon as far as translations.
Superintendent, we do have some seating for buses for the students with special needs.
Okay, so I stand corrected, right?
So just so people are aware of that.
But students without special needs and are going on a school bus can sit where they want as long as social distancing and face masks are worn. Jackie, where were you on here? I feel like we kind of went sideways with the comments. Did you go through all of this?
I think so. We are going to, we diaper just in case you have a student who is not toilet trained and needs assistance in the bathroom. We do have designated bathrooms, and we have designated changing areas for students who are wearing disposable briefs so that we can change them in a clean and safe place.
So Ms. Flores, to answer your question, the teachers knew last year that it was pretty much, we've got to keep distance between children. Oftentimes our little ones go and hug their teachers. And it's a very hard thing when they're hugging their teacher for a teacher to say, get away from me, kind of thing. So they are aware that's not the norm, but I'm not going to say that it never happens. The little ones get excited when they come in, They want to hug each other. They, you know, last year that was one of the toughest things because we are social. And our students are used to coming into school and being able to hug friends and talk to friends, and hopefully our students are a little more adjusted to this new reality for a while until COVID actually goes away. Next slide, please. Jackie, do you want to take it?
No, I don't have another slide here. Sorry.
Oh, you don't? You don't see it? So as far as cleaning, disinfecting, and hygiene, again, we have continued adherence to guidance for the operation of our central and non-central ventilation systems. We will continue to use outdoor spaces. We have the tents back up for inclement weather. They are there with us until at least the first snowfall. Gloves will be used whenever there's contact with blood or body fluids. That's always been the case. And principals will work to ensure that staff limits the sharing of educational materials between individuals when possible. So this is a little less restrictive as last year. Last year we had everything bagged for students. And I know many of you parents are going out now and buying some of their school supplies, which will be your student supplies. Wherever possible, students will not be sharing.
So I can talk now.
Yeah,
Sorry, I'm having some internet issues here.
Oh.
We're asking parents to please keep personal stuffed animals and toys home. We're discouraging having kids bring them to school. And we will have access, and just as we did last year, to soap and water or hand sanitizer containing at least 60% alcohol at all times. And younger students are supervised when using hand sanitizer. We will continue to stress the importance of washing hands. That's one of the best things we can do for any virus or germ to help keep that down. So students will be washing hands when they come back from phys ed or lunch or other activities like that. And we encourage you to work with your child and encourage them to wash their hands.
So 2 additional questions. Is homeschooling optional after the student starts the school year in person? So the answer is yes. You can if you make a decision not to have your child stay enrolled in our school system, you can, and Matt, can you put the contact information for Kiva Mancini in the chat? You can request paperwork, and I think there's also a link where they can request the homeschool paperwork as well. Marlena, the older kids were high-fived and hugged pre-pandemic, especially high school, right off the buses. I know, those were days that I was there as well. Is it something that's being stopped now? It's going to be limited. The hugs are hard. You know, everyone's into fist bumping now, which is our kind of our new shake. And high five still. And again, Jackie made the point that really, and I did forget to say this, Jackie, frequent hand washing is going to be the it, right? And so every classroom is going to have hand sanitizer in there. We make sure that all of our bathrooms have the all the soap. So it's just getting our kids in the habit of constantly washing hands. And so I have Myra here now, Myra Rodriguez. Thank you, Myra. And so if I know that there were some questions, if you would be so kind to just put the questions in the chat, you can do it in Spanish and Myra can answer your questions. And I will say we will be doing a town hall for Spanish speaking only. And we will also, if there's the interest or the need, we'll be doing one in Arabic as well within the next week. All right. You're up, Jackie.
Okay, so what happens if a student's a close contact? If we find out that someone has tested positive for the COVID-19 virus, what we're going to do is use the guidelines from the Center for Disease Control to determine who the close contacts are. Once we determine who close contacts are, then we will be notifying the families of those students. This is no different than what we did last year. We'll be telling you that your student is a close contact, when the last time was that they were with the person who has tested positive, and how many days are remaining in the recommended quarantine time. For students who are 12 and above, this year we'll also be asking families of close contacts if their child has been fully vaccinated. Children who are fully vaccinated do not need to quarantine. For students who are under the age of 12 or those students who have not been fully vaccinated, they will need to quarantine, and we will let them know how many days are remaining until they can return back to school. We'll also be recommending to everyone, as is guidance from the Center for Disease Control and the Department of Public Health, that if they are told they're a close contact to someone who is tested positive, they themselves should get tested no sooner than day 3 to see if they too may be positive for COVID-19.
Thank you. And Matt, I just have to ask you a question now. I want to know where we are on the slide deck, because what I want to respect the people who need Spanish translation, and I don't want to make them. I was going to try and recap if we went through the slides. Myra, is that difficult for you to do?
I can read the slide that's on right now. Recapping might be a little bit hard because I know you've already gone through a couple of them.
We have, but I think the ones that are most important today is the fact that our staff must be vaccinated by September 27th. There are exemptions though, and I want to make sure that our Spanish-speaking families understand that. That was one of the ones that we started off with. Those are some of the changes. So
Okay.
if you can just simply state it that way.
Okay. So, el distrito escolar lo que está haciendo es que está requiriendo de que todos los miembros del distrito escolar estén vacunados antes de septiembre 27. Como dice aquí, el gobernador fue una orden que fue puesta por el gobernador Lamont. Estamos, le voy a leer lo que está escrito aquí. Que estén vacunados contra el COVID-19, que haya recibido la primera dosis o la segunda dosis, o que tenga una cita para la segunda dosis de Pfizer, Moderna, y que haya recibido la primera dosis como Johnson & Johnson, y que también esté exempt de los requisitos. La única forma de que no se va a requerir de que una persona que trabaja con el distrito reciba la vacuna es que si la persona recibe una nota del doctor indicando de que el maestro o la persona no puede obtener la vacuna. Sin embargo, si esto no se puede proveer, el personal será requerido tener su vacuna antes del 27 de septiembre.
Thanks. And Myra, I'm going to read a question, and then I'll read the question. And is it easier for you to read the question in Spanish? We'll do it that way, or should I answer the question and then you do it all?
We can go back and forth.
Sounds good. Okay. The questions keep jumping here. Do students that have been vaccinated need to bring their vaccination card to the school nurse?
Para los estudiantes, la pregunta es si los estudiantes están vacunados, si es necesario traer la tarjeta de vacunación para la enfermera.
Jackie?
Yes, if they bring it to the nurse, we can record in the student's medical record that they've been vaccinated, and then we know they do not need to quarantine.
Si tienen la tarjeta de vacunación, por favor, proveérselo a la escuela para que se lo proveen a la enfermera y ellos lo van a ingresar al documento del estudiante con toda la información de ellos.
Thank you. Next question. If students 12 and older aren't vaccinated, do they still go to school on the 1st? Jackie?
Absolutely. They still go to school on the 1st.
Ok, la pregunta es que si cualquier estudiante que tenga más de 12 años y no esté vacunado, si todavía puede asistir al primer día de clase, la respuesta es sí. Sí pueden atender el primer día de clase.
They are not required to be vaccinated.
No están requeridos de tomar la vacuna.
One of our parent/staff members is asking if we'll be offering clinics for the booster shot when available. Go ahead, Myra, first.
Yeah, una de las preguntas es que si van a haber clínicas disponibles para el personal para dar las vacunas.
And the answer is yes. We are working with the city health department to set up vaccination booster clinics for any of the people that we vaccinated at our at our shot clinics. They were open not only to staff, but also to the public. And there will be booster clinics available at many sites throughout the New Britain area.
Thank
Van a
you.
haber,
Oh,
van a
right.
haber varias clínicas que se van a abrir dentro del distrito para las personas que trabajan en el distrito y también para la comunidad para dar la vacuna del booster para los que los necesiten.
And there was another question that I was waiting for you, Myra. Will you offer COVID tests on vaccinated students if they show symptoms? Go ahead, Myra.
La pregunta es que si se va a ofrecer examen de COVID si una persona demuestra síntomas del COVID.
So the school nurses do not offer COVID testing. We are working with our school-based health centers to see if they would be able to offer COVID testing.
Nosotros como distrito no vamos a ofrecer el examen, sin embargo vamos a trabajar con el Departamento de Salud para poder proveer estos exámenes si se necesitan.
And there's a comment from Lisa Ann, and she said the New Britain High School girl bathrooms don't always have soap in those dispensers. So the answer to that is we will notify the building principal.
El comentario es de que el baño de las mujeres, de las hembras en la escuela de high school a veces no tienen jabón para lavarse las manos. Se les va a notificar al high school para que se pongan, para que puedan poner jabón y que se aseguren que siempre esté a la mano.
And Veronica is asking if we can bring teachers hand sanitizer and other disinfecting supplies for the classroom.
That is a very, very generous offer, but not necessary because we have we've purchased and we've also received many, many donations. We have lots of hand sanitizer and wipes, and it's readily available to all of our teachers.
La pregunta fue que si un padre quisiera traer sanitante para los maestros, que si se puede hacer. La respuesta es que es un complemento muy generoso. Sin embargo, hemos tenido varias donaciones para los wipes y también para el sanitante de mano y no es necesario, pero que se les agradece por querer ayudar.
And how on the bus are the students going to be socially distanced, especially for kinders and first graders?
La pregunta es cómo se va a distanciar o asegurar de que los estudiantes de kinder y de primer grado se mantengan en distanciamiento adecuado.
Jackie?
So we know that our bus drivers and on some of our monitored buses, the bus monitor will be directing our younger student, our younger learners where to sit on the bus. And I will tell you, having had my kids attend elementary school in New Britain, that there are some bus drivers that do actually assign younger students to specific seats on the bus to help make sure that they are socially distant.
Los estudiantes serán dirigidos por la persona que esté manejando el autobús y van a ser dirigidos para asegurarse de que estén sentándose en lugares adecuados para mantener el distanciamiento que se requiere.
And I thought there was one more question from one of the, hold on, I might have lost it. No, I think we got all of those. Ms. Guzman, any information on Chamberlain Elementary being that they are being transferred? I'm not sure what information you're looking for, but Matt, if you can put my contact information, Ms. Guzman, you know they'll be going over to the Pope John Paul building. That will be the Chamberlain site for the next 2 years. And the building will be ready for students by next Wednesday. They're working feverishly over the weekends, etc., to make it ready for students. Sorry, Myra.
It's okay. El edificio de Chamberlain Elementary School en este momento se llevará a cabo en la escuela de John Pope Hall, creo que era. En este momento se está trabajando en la escuela para tenerla lista para el miércoles que viene. Si tienen alguna pregunta, por favor de enviar un correo electrónico o de llamar a la escuela para poder responder a cualquier pregunta que tengan. Y esto va a ser algo, esto va a ser algo de 2 años. Los estudiantes estarán en este edificio por un total de 2 años, más o menos.
Okay, next slide.
So This
Oh,
is the next side,
oh.
which has to do with COVID screening during the school day.
Okay,
So-
so Jackie, 1 second. I want to just find out what's the best way for Myra? Is Jackie to do a couple of sentences, stop, or how do you want to do that?
If she wants to read a couple and then stop, so it can give me time to go ahead and do this translation. Yep.
Okay. So if a student is identified as a close contact to someone who has COVID, then we remove them from the class and take them to a separate room in the building that's supervised by a nurse.
Si hubo un estudiante que se identificó en contacto cercano con otra persona, ese estudiante será removido del cuarto y se enviará a otro cuarto para que pueda estar solo y no en contacto con otros estudiantes mientras que investigan el caso.
If the student is 12 or older, we'll be asking or looking at the student's medical records to see if they've been vaccinated for COVID. If they are fully vaccinated, they do not need to quarantine and they can go right back to class.
Para los estudiantes de 12 años o mayor, la enfermera determinará si tiene la vacuna o no, y si el estudiante está completamente vacunado, podrá regresar a la clase.
For students who are not vaccinated, the student will remain in the isolation room with the nurse. We'll be contacting the parent and asking them to come pick up the student, and the student will need to stay home and be on quarantine.
Si un estudiante no está vacunado, el estudiante se mantendrá en el cuarto solo con la enfermera y se le llamará al padre o al guardián para venir a recoger al estudiante.
Thank you.
So those are for students who are contacts. For students who are sick, who are ill with COVID or flu-like symptoms, they will go into the isolation room, this separate room that's supervised by the nurse. The nurse will assess them, take their temperature and their symptoms, and then call the parent to come and pick up the child.
Para un estudiante que tenga los síntomas de COVID o que tenga los síntomas de gripe, se removerá de la clase y se llevará a un cuarto donde va a estar solo con la enfermera y se le revisará la temperatura para revisar si tiene calentura o no, y también un padre se le llamará para que venga a recoger al estudiante.
And we will always remind everyone, for the health and safety of everybody, staff or students, if they're ill, they can't stay, they need to go home.
Que para cualquier estudiante que se sienta mal, que por favor se le recuerden a los padres que se tienen que mantener en casa, por favor no se envíen a la escuela, porque serán reenviados a su casa de nuevo.
Thank you. Next slide, Matt. We already did the student travel. This is for student athletes and when they have to quarantine.
So the student athlete rules for quarantine are different. We have student athletes follow the CIAC playing guidelines. If students athletes are fully vaccinated, and this applies to coaches also, then they do not need to quarantine unless they are ill.
Si una persona que está en un deporte está en contacto cercano con una persona que tiene COVID-19 o que se ha identificado con COVID, no tendrá que mantenerse fuera no se tendrá que quedar en cuarentena, podrá regresar.
Students or coaches who are not vaccinated are not allowed to play or practice for 10 days if they get tested and have a negative test, or 14 days if they don't have a test.
Un estudiante o un coach que que no esté vacunado y que que se haya encontrado en contacto cercano con alguien tendrá que mantenerse en cuarentena por 10 días con un examen negativo dentro de 7 a 10 días o 14 días si no tomó un examen.
Thank you. Next, there we go. I'll take this one. This was some of the questions about if my child has to quarantine, how will they stay connected?
Esto se trata si si mi hijo tiene que mantenerse en cuarentena, ¿cómo se mantendrá conectado?
First off, we are here to partner with you.
Estamos aquí para trabajar con usted.
And I'm sorry that remote learning isn't an option at this time.
Y nuestras disculpas que ahorita la educación remota no es una opción en este momento.
All teachers will continue to maintain Google Classrooms or Seesaw for our youngest learners this year. That quarantining students will have access to see all of their assignments, to submit all of their work, and send questions to their teachers.
Todos los estudiantes mantendrán sus Google Classroom o CSDNB mientras estén en cuarentena y tendrán acceso a sus trabajos y también a sus maestros durante este tiempo.
Students and families who are helping out their littler ones will also have access to the teachers' lesson plans posted every Friday afternoon for the next week.
Estudiantes y padres también que le estén ayudando a un hermano o a alguien menor, también tendrá acceso a la información de los maestros para poder proveer la asistencia necesaria para el estudiante.
Students, if they have instructional materials other than their computer that they need, will continue to have access to those materials, even if we have to run them to your house or you pick them up when you pick up your child.
Si hay material instruccional físico que se tiene que enviar al estudiante, nosotros le enviaremos, aunque sea nosotros teniendo que dejárselo personalmente en su casa, se le dejará en su casa para que el estudiante siga trabajando.
And after school, and there's a typo in this slide, Matt, just so I know, because now it's the second week in a row. After school, virtual academic support sessions are going to be made available for elementary and secondary, which means middle and high school students by grade level and by content area.
Soportes académicos virtuales para después de la escuela serán disponibles para todos los estudiantes de todos los grados.
And so while they're not going to be in class because they're quarantining, they have access with their computer to all of the assignments that their classmates are working on. We'll be providing after-school support for all K-12 students. So your child will do their assignments. If they are struggling, they can go on to online after-school support.
Cada estudiante que necesite soporte adicional tendrá toda la opción para poder hacerlo virtualmente y se le proveerá toda la información y todo el acceso necesario para poder ayudarles en cualquier área de contenido, en cualquier grado que estén.
So there's two questions. One of them is in Spanish. Myra, if you could read it and translate it for Jackie. Can you see the comments?
No.
Okay, so if you look on the top right where it says comments, just click on that. Oh, Matt wrote it for us.
Okay.
Do you see it across the screen?
Okay, yes. She said, good afternoon. If the student is sick with a flu, can they take remote classes?
So the answer is no. What we're talking about right now is the way that we are making connections with the students while they're in quarantine.
Desafortunadamente, la respuesta es no. Si el estudiante tiene gripe y se tiene que mantener en casa, desafortunadamente no va a haber la opción de poder tomar el curso remotamente.
And this one goes to Jesse about being marked absent if they have to quarantine. We're still getting guidance from the state. What I do know is if we mark them absent, it'll be with a Q, right? So it will be excused I'm going to say as of today, it will be an excused absent with a Q, somehow noted in PowerSchool that it's because of quarantine.
Cuando un estudiante se marque ausente porque está en cuarentena, se le va a marcar ausente, pero se le va a poner una Q para identificar que el estudiante está fuera por causa de la cuarentena.
Okay, I think we covered all of that. And I just want to say on that last slide, you don't have to go back, Matt. Our administrators and our teachers are more than willing to help out if your son, daughter, or grandchild is in quarantine. Call the school. We have our family school liaisons at the buildings. People are there to help and support you.
Nosotros y nuestro personal escolar, nuestros Family School Liaisons y todas las personas que trabajan dentro de nuestras escuelas están disponibles para poder ayudarles en lo que ustedes necesiten y por favor comuníquense con nosotros cuando tengan alguna pregunta o si necesitan algún tipo de soporte.
And I see one last question. I think it's one last question. It's from Myra. Can I send copies of my son's COVID-19 vaccine from the MyChart Plus instead of sending him in with the actual cards? You're on mute.
Let me just do the question right quick. La pregunta es que si se puede enviar una fotocopia de MyChart, que es una aplicación donde se puede obtener la información de COVID en vez de enviar una copia de la tarjeta.
I'm not able to open my chart, but what they can do is take a picture with their phone and email it to me, and I would be happy to get it to the school nurse. Or they can print a copy off from the State Department of Public Health website. Again, they can email me and I can send them directions to do that.
Desafortunadamente no tenemos acceso a la información de MyChart, así que si pueden enviar una copia o si lo pueden hacer como un screenshot y enviárselo a Jackie Mary, ella se asegurará de poder enviárselo a la enfermera que está dentro de su escuela.
Matt, can you put the question on the screen for Myra to see from Ms. Figueroa?
If a student has medical appointments, should they take a medical note the next day?
Yes, we encourage parents to do what they can to schedule medical appointments later in the day so the child doesn't miss too much school.
La respuesta es sí, pero también les sugerimos a los padres que si por favor pueden hacer las citas un poquito más en la tarde para que el estudiante no pierda mucho de la escuela, pero sí por favor traer una nota al siguiente día y entregárselo a la oficina de la escuela.
And Ms. Paquette, this was a question we answered earlier, and it says vaccinated people, even asymptomatic, can transmit COVID. How is it safe to not require them to quarantine? Myra, do you want to translate first?
Okay, can you read that question again?
Sure. Matt, you can put it up on the screen. Maybe
Yeah.
you see it.
Okay, la pregunta es, personas que están vacunadas, aunque sean asintomáticas, si se pueden transmitir el COVID, ¿cómo es posible de que no se requiera de que ellos mantengan su cuarentena?
We know that COVID is transmitted by respiratory viruses. And so masking is one of the best ways that we can help prevent the transmission. We also know that it is...
Hold on, Jackie. When you go medical on us, it takes us a while to translate.
Okay.
Go ahead, Myra.
Aunque todos sabemos que mantener la mascarilla a todos tiempos es muy, muy importante y que ha sido lo que ha ayudado a evitar que se transmita el COVID de persona a persona.
People who are vaccinated are significantly less likely to be positive for COVID.
Personas que han sido vacunadas no son muy probables de contagiarse del COVID.
So we're following the CDC guidance that those who are vaccinated, and remembering that all of us in the school system, all of our adults must wear masks, make the risk significantly small to anyone in the building.
Al requerir de que nuestro personal de escolar todos mantengan mascarillas puestas y también por la razón de que están vacunados, esto elimina y disminuye el contagio de COVID entre personal escolar.
Okay, and Miss Manning, who is sitting in the back, the question is, Jackie, you were speaking about emailing you vaccinations, and Miss Manning wanted Miss Flores to know that we will have a process for getting vaccination verification from the kids, and we'll message soon. We can have it ready for next week, or even before then.
Yeah. Va a haber un proceso para que los padres puedan entregar las tarjetas de vacuna para nosotros tener eso en los expedientes de los estudiantes. Esa información saldrá pronto.
Okay. I want to respect the time. I know we ran a bit over. Myra, thank you so much for coming on. Thank the families and everyone on the call. We are an email away if you need us. And we'll be back next Wednesday, and we'll be sending out a notice when we'll be doing one solely in Spanish. And if the need arises, we'll do one in Arabic as well. Stay safe. And your kids are coming back to us in a week. Have a great night. See you next week.